Well, last year we saw very little influenza, and if we're really lucky again this year, we may not see very much again. But that's going to depend on, I think, high vaccination rates, along with continuing many of the public health precautions, hand washing, mask wearing when appropriate, and distancing. Both the COVID vaccine and influenza can be given at the same time. There's no concern about increased side effects from both vaccines, nor are there any concerns about them not working as well. You may get a sore arm from both, but overall side effects are very limited, very minimal with both of these vaccines. They're both very safe. So COVID-19 and influenza are two very different respiratory viruses. The vaccine against COVID will not protect against influenza. The vaccine against influenza will not protect against COVID. So we really are recommending that you be vaccinated against both viruses to protect you and your family and your community. Symptoms of COVID and influenza are very similar. Fever, headache, sore throat, runny nose, muscle aches. And so based on symptoms alone, you cannot differentiate the flu from COVID, and sometimes even from other respiratory viruses. We see RSV, we see parainfluenza, we see other causes, rhinovirus. Many respiratory viruses all cause the same type of symptoms. As a result, I expect we're going to have to do more testing. Anybody with symptoms would be advised to stay at home and then be tested as guided by public health. Vaccinating children for influenza is probably one of the most important things we can do. Children are very prone to influenza. There are serious consequences of influenza in children, albeit rare, but children are often the source of influenza to those adults and particularly older people around them. So vaccinating children is I think one of the most important things we can do. The vaccine is available free for anyone over the age of 6 months. So I would encourage everybody, parents, grandparents, to encourage vaccination of children as one of the best things we can do in our community. Pregnant women are more at risk of severe complications from both influenza and COVID. We've already seen reports of more severe disease in pregnant women. So if there's one thing that pregnant women can do to both safeguard their own health as well as the health of their newborn baby, it is to be vaccinated against both of these quite serious respiratory viruses, COVID and influenza, and the vaccine is safe in pregnancy. Particularly with influenza, if a mother has been immunized, the likelihood of her newborn baby getting influenza in the first 6 months of life is reduced. And of course, influenza in a young infant can be a very serious illness as well. Vaccination is one of the most important steps, along with those public health measures that we're really becoming very used to, such as hand washing or using hand hygiene, masking when it's appropriate, along with the other public health measures, avoiding large crowds when that's relevant. But vaccination remains a hallmark of protection against influenza. As the flu season approaches, it is really vital that we protect both ourselves, our patients, our family and our community from influenza as well as COVID. The best way to do that is to make sure that you've had your vaccine and encourage vaccination in others.